Suffer some severe disease of the heart valves, and it was not until recently that patients too high at risk for traditional surgery were able to have that problem treated. Here to tell us all about a new procedure at MUSC are doctors John Economides and Daniel Steinberg. Gentlemen, thank you so much for being here. We appreciate it.
Thank you for having us.
Always such great things going on at MUSC. Tell us about this new procedure and how it's helping patients.
Well, hundreds of thousands of patients every year have aortic stenosis, and a substantial minority of those patients are not able to undergo surgery, whether the risk is too high or for other reasons it just can't be done. We have a new catheter procedure here at MUSC and other centers across the country, but we are the first in South Carolina to have a new catheter-based procedure whereby we can replace these valves without traditional surgery.
Wow, it sounds absolutely amazing. Now, what were some of the preventative things that were keeping people from getting this surgery before?
Often it's about risk. It's the age of the patient, for instance, or other health issues that preclude the ability for them to make it through the operative procedure. It's not always the operation that's the biggest challenge. It's what happens in the post-operative period that may make the patient at too high risk to undergo both the operation and then the rehab afterwards.
Absolutely. Now, it sounds minimally invasive compared to the regular surgery. Dr. Economides, why don't you tell us about that and how people are recovering, how long it takes for this, and the quality of their lives afterwards?
Well, as shown by the video that everyone's seeing now, a balloon is just advanced through a very small incision in the groin to crack open a diseased aortic valve, following which this device, which is a transcatheter aortic valve, is then advanced over the diseased valve and deployed, basically pinning the diseased valve into the aorta and expanding this new valve and creating an aortic valve replacement. This procedure is done through a small incision in the groin to access the femoral artery, and in later stages can actually be done completely percutaneously without any incisions at all. And it can often be performed inside of about an hour and a half. And these patients, despite the fact that they're severely debilitated and are undergoing this procedure because they're not considered candidates for open surgery, do surprisingly well and are discharged from hospital in a very short period of time, in a matter of days, with really relatively few complications.
Yeah, what's the recovery time like for the traditional surgery versus this new procedure?
We typically tell patients that typical recovery time from an aortic valve replacement is of the order of 2 to 3 months.
Right.
And that's the time it takes for the stress response to surgery to sort of dissipate, and also all the healing of various incisions. And so the recovery time from this procedure is substantially lower than that. A matter of days, really.
Now, will this surgery eventually replace that traditional surgery?
That's an excellent question. And at the present time, the procedure is FDA approved for patients who are considered to be inoperable. The procedure is moving in the direction towards high-risk surgical candidates. And it's not unreasonable to envision a situation where lower and lower risk patients will be considered candidates for the procedure.
Well, it sounds absolutely fascinating. Again, the surgery, and if you want to learn more about it, that website right there on your screen. Doctors, thank you so much for coming on the program. We really appreciate it. Fascinating stuff.
Thank you very much.
We salute you, definitely. All right, when we come back, we're going to have your tips on getting your blog, The Fast Track for Success with the Center for Women. Let's go next.